Kari, thank you very much indeed for participating in the symposium today. It was great to see your very incisive review of the terminology and the way in which it has been utilised in a commercial setting. Clearly, though, we have to use symptoms because that's what patients come forward with, and we have to have a definition for those symptoms. So we have overactive bladder, or something akin to that. How do you see that progressing in the future?
Yeah, thank you. First of all, it was an honor to be part of this. It's really, really exciting debate. I think the trend during the last 10-15 years has been to go from an organ-specific terminology to more descriptive if we really don't know that it's organ-specific, such as we don't use prostatism anymore, we use lower urinary tract symptoms. And I think that's a little bit the same analogy with overactive bladder, that we are not sure whether the problem is in bladder, so we should maybe not use the overactive bladder term. And we also use stress incontinence. Why don't we use then urgency incontinence and urgency? That's one option. I completely agree that of course we are treating symptoms, quality of life. We should use symptom terminology. What we should do in future more, we actually ask these things more about patients. We should include more patients in the research and not just define ourselves.
No, you're right. But I mean, how many people do you think, bearing in mind that urgency doesn't exist outside English in many languages, would be able to use that if one says urgency or urgency frequency?
Yeah, this is a very difficult question to answer. In some languages we have better words than others, but at least nocturia, urinary frequency, or increased daytime frequency, and sudden desire to pass urine, somehow they, I guess, are in most languages. But I agree that I don't have any perfect answer. I think nobody has it. I think my talk, the major point of that was that we have to acknowledge that it's not one disease, and sometimes we are forgetting it.
No, I agree with you. I think we all agree that we're talking about a symptom complex which is not disease-specific, which is not condition-specific, and which has to be interpreted in that context. And as clinicians are working in the area, it's very important we get that message across whenever we speak. Thank you very much indeed, Kari.
Thanks, sir.
Well done.